Hello everybody and welcome to Dr. L's series of brief evidence-based answers to important health and wellness questions. And today's question is, what is nutritional immunology and what are the key nutrients I need to include in my diet to help support the function of my immune system, especially during this flu season, during this ongoing COVID-19 pandemic. In simple terms, nutritional immunology is the study of key nutrients that are important for the modulation of the immune system and to help improve the function of the immune system without ending up overreacting. It also might have to do with some pathways related to COVID-19 virus. In general, we want our immune system to be able to perform its surveillance activities to find pathogens such as viruses, bacteria, and other microbes and get rid of them without overreacting. There is something called the inflammasome NLPR3. This is like an immune system messenger that initiates or starts the inflammation process to overcome the infection. This inflammasome it's a molecule made out of multiple proteins. Sometimes it can get out of hand and it can cause more inflammation than necessary, which can cause what we refer to as the cytokine storm, especially in people with pre-inflammatory conditions like diabetes mellitus, heart conditions, circulatory disorders, obesity, and so on. Now, what are these key elements that we know important for the function of our immune system? I'm going to discuss with you 5 essential ones. That includes zinc, it includes vitamin D3, it includes quercetin, epigallocatechin galates, and sulforaphane. We start with zinc. Zinc is very, very important for the function of both the innate immune system and the adaptive immune system. In a recent study on people hospitalized with COVID-19, the two groups got the same standard treatment. Standard treatment these days is remdesivir, dexamethasone. Sometimes they also add monoclonal antibodies or convalescent plasma, depending on the person's condition. However, one of these two groups, in addition to the standard treatment, got supplemental zinc, and this group was able to leave the hospital earlier than the group that only got the standard treatment. Where can we find zinc? We can find zinc in protein. We can find it in red meat. We can find it in eggs. We can find it in shellfish like oysters. We can find it in nuts and seeds, especially pumpkin seeds. We can also find it in legumes, chickpeas, lentils, some beans. You can also find it in dark chocolate, and it also exists in some vegetables like potatoes and sweet potatoes. Vitamin D3. Vitamin D3, the best source for vitamin D3 is the direct exposure to the sun, but if that is not possible, then we really need to supplement with vitamin D3 to make sure that our serum vitamin D3 level is between 40 and 60. Nanograms per milliliter. I personally, especially during the flu season, would like for my serum vitamin D3 level to be around 50 for optimal performance of my immune system. The food that contains vitamin D3 includes salmon, herring, and sardines, canned tuna, cod liver oil, fortified food. It also exists in mushrooms, reishi mushrooms, shiitake, maitake mushrooms. Mushrooms are also important to support the activity of natural killer cells. Now, the next micronutrient is quercetin. Quercetin is not a vitamin nor a mineral. It is a polyphenol that is a natural chemical that exists in plants to help plants survive their environment. These polyphenols have been proven to be very, very important for us. They act as antioxidants and anti-inflammatory as well. And quercetin especially is an antiviral because it binds to the spike protein of the virus, and it helps to prevent it from getting inside the cell to replicate. So it helps the replication of to prevent the replication of infected cells. Where can I find this quercetin? It's in apples, in onions, in parsley, in olive oils. It's also in grapes, in dark berries like blackberries and blueberries, and it's also in dark cherries. The epigallocatechin galates, or EGCG, we find it in green tea. I personally like to have about 4 cups of green tea a day to get my EGCG. EGCG is it's also anti-cancer because it's an anti-angiogenesis. It prevents, it interrupts the blood supply to the tumors, and it also supports the production of glutathione, which is a master antioxidant. And finally, sulforaphane. Sulforaphane is really important for the production of glutathione. As we said, glutathione is a master antioxidant and detoxifier of the body. It also helps to stabilize the mast cells, so it helps to modulate the inflammation in the body. People who are deficient in glutathione, they are at a higher risk for infection, and it's hard for them to overcome infection as well. Glutathione is really important for the overall function of our immune system. Where can we find the sulforaphane? We find it in cruciferous vegetables like broccoli, cauliflower, cabbage. It also exists in onions and garlic and shallots, it's also good to have green tea because of the EGCG that helps with the production of the glutathione. I tried to make this as short as possible, and I hope that I gave you some good tips to use during this flu season and during this pandemic. You stay safe and stay well, and see you next time. Bye-bye.